Hey guys, Dr. Mark Poole here. In this video, I'll be discussing how much help will my loved one need at home after heart surgery. A lot of patient families ask me, how much help is my loved one going to need at home? Either father, mother, perhaps grandfather, grandmother, and they're interested to know, are they going to need to stay at their house? Do they need to come from out of town to take care of them? And it's a serious question. Well, the answer is, it depends. Oftentimes, if the patient required help before the operation, then they're still going to need that same type of help after. So if a patient is in an assisted living facility, they're going to need that same type of help at home. But if the patient is independently functioning, maybe they're still driving, and they're able to do all of their activities of daily living, then they're unlikely to need much of any help once they go home. With a typical heart operation that's not an emergency, most patients come from home, get the surgery, and then they get back home again within 4 or 5 days. At that point, the patient's walking around under their own power, they can take a shower, get dressed, fix their own meals, so in general, they don't need all that much help. No one has to sit there 24/7 and watch the patient like a hawk. Of course, it's very nice if someone is at the house and able to care for them or tend to them and get things for them and that type of thing, but in general, it's not necessary to provide a safe recovery. And it's also helpful to do certain tasks like taking out the trash or anything that's heavy, because we don't want patients to be straining after an operation. So mowing the lawn and some vigorous activity like that needs to be held off for several weeks, and someone can be very helpful in assisting the patient with that. But moment to moment and day by day, not that much help is needed for most of our patients. And it is a case-by-case basis, so if your loved one is approaching a heart operation, be sure to ask the surgeon in particular what the expectation is for how much help they'll need. Fortunately for most patients, it's not very much, and they're able to get along on their own. So be sure to check out my other videos, and God bless you and your loved one in your journey.